By now, you've heard a lot from me, but you have yet to see me. Let's change that. Here's a little bit more about me. I'm a first-generation low-income college student who grew up all over the West Coast, calling Las Vegas, Nevada, Portland, Oregon, and Vancouver, Washington home. I'm a rising senior at Pomona College, and I study molecular biology and will be minoring in music. I find myself sitting before you now because I would like to have a conversation. Today we are diving into the lesser discussed, but arguably more important revelations that this pandemic has shown. The cracks in our system that have existed long before the virus reached American soil, which have disproportionately harmed minority communities. Before we get into this, there's a lot to be said about this issue, and we can't do this data justice with one video, so we've included additional sources and resources at the end. Now, let's start with some quick facts. Black and Latinx communities have been hit the hardest in the United States as of May 8th. In mid-April, Black Americans had a higher coincidence of infection and death according to their share of the population. These states showed more hospitalizations for African Americans. Latinx citizens were hit the hardest in both New York and LA County. Latinx communities make up 19% of the population, but 33% of the cases nationwide. And that number is steadily increasing. Latinx communities are most likely to contract the virus, but more likely to survive than African Americans. African Americans are more likely to have fatal outcomes with the virus. Native American communities have also been hit incredibly hard as well, with over 2,700 cases and 80 deaths by May 8th in the Navajo Nation alone. Early on in the pandemic, Native Americans in New Mexico made up 1/3 of the deaths, despite only being 9% of the population. It doesn't take a data analyst or epidemiologist to see that this is a systemic issue. The virus is not biologically designed to harm specific communities. The only reason we are seeing disparities is because of pre-existing systems that perpetuate inequality in our healthcare system. Let's examine why these communities are negatively affected by COVID-19. For starters, living conditions. People of color and their respective communities tend to live in intergenerational households that hold more people than the average white household. Setting aside the cultural factors, racial and ethnic minority communities are more likely to live in densely populated areas due to racial housing segregation. This has led to an increased exposure to pollution, environmental hazards, and societal roadblocks, which lead to more people dying or becoming severely ill. Black and brown communities are most affected by these institutional gaps. Additionally, certain racial and ethnic minorities are overrepresented in jails, prisons, and detention centers, all spaces where we have seen a spike in cases. Prisons and jails provide a unique challenge in that it is virtually impossible to socially distance properly, compounded by the fact that PPE and cleaning supplies are in such high demand and not easily accessible to inmates. Overcrowding and lack of physical space to safely socially distance is also more likely in tribal reservation homes and Alaska Native villages. Working conditions are also a major factor in increasing the risk of COVID-19. Members of the Black and Indigenous or people of color communities are more likely to work in service jobs or frontline jobs, as well as essential services, all positions that have a higher risk of transmission. Finally, health conditions have a lot to do with the heightened severity and mortality rate of the virus in Black and brown communities. Minority communities tend to have less access to health insurance and adequate medical care. For instance, almost 2,000 low-cost/free clinics that serve minority populations have shut down since the pandemic began, leaving hundreds, thousands, or even millions of people without access to affordable health care. This is compounded by the need for affordable care brought on by skyrocketing unemployment rates. Low-income citizens may not receive care due to the cost of missing work, and they may endure more painful symptoms to prevent taking sick leaves. Just listen to one McDonald's worker describe their experience at the beginning of the pandemic.
I've worked at McDonald's for over 10 years. I'm that face that you see that serves you your hash brown for breakfast, maybe a quarter pounder for lunch, and they even gave you a McFlurry to top off your dinner menu. So I ask you, if I caught the coronavirus, would you want me making your next meal? And there are 500,000 McDonald's workers just like me that have to go to work whether sick or well because we have no paid sick leave.
Last week I was under the weather. I was sick to the point where I had to leave the grill to go to the restroom, and I wound up vomiting. And I could have been sent home with paid sick leave and not have to worry about coming to work sick because I don't have to worry about how my bills are going to get covered for the days that I missed.
Latinx, Black, and Native American communities suffer from higher rates of underlying medical conditions that have shown to be deadly when paired with the coronavirus. For instance, diabetes and heart disease. Researchers at Boston University found that 11% of black adults and 18% of Native Americans had multiple risk factors putting them at high risk for severe cases of COVID-19, whereas this was true of only 8% of white subjects. Among Americans 65 and older, the same study found that 69% of Native Americans and 61% of black Americans had one or more additional risk factors beyond age, compared with 54% of white adults. As Anthony Fauci said at a recent coronavirus briefing, we have a particularly difficult problem of an exacerbation of health disparity. The thing that get people into intensive care and require them to be put on a ventilator, something that often leads to death, are the very factors, Fauci said, that are unfortunately disproportionately prevalent in the African American population. As such, data categorized by race and ethnicity is crucial to addressing the healthcare needs of each community during this pandemic. But in practice, accurate information is very difficult to get a hold of. Some states are categorizing Latinx people as white, while other states only have 3 options for race: black, white, or other. Many states, including New York until recently, only took racial data for deaths, but not cases. As of May 24th, only 54% of cases included racial data about the patient, while 92% of deaths included data on race, meaning the information we have is awfully unreliable as of now. Many experts think the data we have doesn't properly show the disparities that people are facing. Minority communities are also less likely to get tested and have less access to affordable testing or safe transportation to testing sites. Undocumented citizens are less likely to get tested or pursue medical attention out of the fear of deportation. In 4 out of 6 Texas cities, the testing sites are disproportionately found in whiter communities. This creates a big problem with the way aid is being distributed. Accurate data on how the virus has affected low-income communities of color will allow leaders to have a tailored public health response, a direct approach that will address the specific needs of the communities most affected. Now, something that we haven't mentioned yet is the rise in hate crimes against the Asian American and Pacific Islander communities in the United States, a unique byproduct of this particular pandemic. Here to join me in addressing this is the other half of Clarifying COVID, Karen Song. Karen, can you tell us a little bit more about how the situation has affected the Asian American population?
Absolutely, Shahid. From the beginning of this pandemic, there's been a steady increase in anti-Asian rhetoric and hate crimes. The rise in verbal and physical attacks, both direct and indirect, to the Asian community can be attributed to the widespread knowledge that the first cluster of cases of COVID-19 were reported in Wuhan province of China. In the US, there has been higher rates of hate crimes, xenophobia, racism, and anti-Chinese propaganda against Asian American citizens. They've been noted since the start of the pandemic, with 1,500 reports of verbal and physical assaults in a single month being documented by advocacy groups. For comparative purposes, in 2018, the FBI found that 3.8% of racially based hate crimes were targeted at Asian American citizens. In comparison, by May 2020, in New York alone, 40% of documented harassment and discrimination cases were against Asian Americans. This drastic increase in hate crimes can be attributed directly to individuals with predisposed biases, but it's actually a lot more important to look at how governments and leaders have contributed to this sentiment. For example, across the world, government officials and leaders of certain political parties have used the COVID-19 pandemic and its origin to advance anti-immigrant, ultranationalist, xenophobic, and white supremacist agendas. Of course, the US is not exempt from this. We can see this very clearly in how President Trump has repeatedly used racially offensive terms such as the Kung flu or the China virus to direct the blame of the pandemic onto Asian, specifically Chinese communities. The deliberate use of this language for the purposes of fear-mongering and scapegoating distract from the fundamental cracks in the American system that the government has yet to address. Cracks that have contributed to the US skyrocketing past every other nation, including China, in terms of coronavirus cases and deaths. I think at this time it's very important for us to acknowledge and for our nation's leaders to remind everyone that the virus does not originate from a specific race or ethnicity. It does not occur more commonly in a specific race or ethnicity. It knows no national boundaries, and a person of Asian descent is not more likely to have it than any other citizen.
Thank you for that overview. And as we hope all of our viewers are aware, hate crimes, senseless discrimination, and abuse are never acceptable. And we should all be part of ensuring that myths about certain groups of people are not perpetuated in our own circles, and government officials should be held accountable for hateful speech.
Yes. Well, Thank you for having me.
Of course. And on that note, this concludes episode 3 of Clarifying COVID-19. Next up, vaccines.